Welcome to a PreventConnect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
Welcome, everyone. This is our web conference today called From Foundations to Innovations, Applying a Public Health Approach to Preventing Sexual and Domestic Violence. My name is Ashley Klein-Jimenez, and I'm so glad that you have joined us today. I want to introduce you to our main facilitators today, our friends at Prevention Institute, Alicia Somji and Morgan Kroos. Alicia, I'm going to go ahead and turn this over to you and have you take it away.
Thanks, Ashley. Welcome, everyone. Thank you so much for joining us I know that this isn't the first PreventConnect web conference of the year, but it is the first one that I'm facilitating, so I'm very excited to be here and start off the year. And I'm also very excited that we have people from across the country and across the world joining us today, which is always very exciting. So in our web conference today, we are going to be reviewing the fundamental elements of a public health approach. We're going to be going through some emerging themes and innovations in the field, and these really come from our report that we did for 2017 and for 2016. Ashley just mentioned our 2017 report that was based on the web conferences last year. So we're going to be going through some of the main themes that have been coming up over the past few years. We'll also go through determinants of sexual and domestic violence, and end off with examples of effective primary prevention strategies using the spectrum of prevention, which our guests today are going to help us illuminate. So we're excited about getting started with all of this. And I do want to reiterate that we love to have a lot of engagement during these web conferences, so please use the text chat function that you should see on my screen. It's showing up on the right side. So feel free to share any thoughts or reactions anytime. We will be asking specific text chat questions throughout, but even when a question isn't asked, feel free to be using that public chat or even private chat if you want to chat directly with someone specifically. So I wanted to start off with this slide here. With the Me Too movement and the profile of gender-based violence elevating almost by the week, and just last week with the Golden Globes, where we saw actors bringing social justice advocates as their guests, we can really see how these issues are really coming to the forefront. And the advocates that Golden Globe actors brought last week represented issues like rights for domestic, restaurant, and farm workers, just to name a few. And this really speaks true to the fact that sexual violence isn't just a Hollywood issue, but a societal one that affects people across the country. So Oprah inspirationally said, "A new day is on the horizon." And I thought this really connects well with PreventConnect and the web conference series. But really, a new day is only on the horizon and is possible if we can elevate primary prevention so we can truly prevent violence before it happens. So this here is the Prevention Continuum. Those of you who have been part of an introductory web conference with us before have probably seen this. It kind of divides prevention into three categories. Upfront, which is primary prevention, preventing violence before it happens. In the thick, which is more responses right after violence has occurred. And then the aftermath, which is kind of the treatment interventions over the long term. And while all three of these are critical, upfront or primary prevention practices and policies are typically the least explored. And so through PreventConnect, we're really focused on approaches that take place before sexual and domestic violence has occurred to prevent initial perpetration or victimization. So now I'd like to kind of move into some of these emerging themes that we've been seeing in the field of sexual and domestic violence prevention at the community level. So through the years, we've been seeing these different things coming and be more common in practice. The first one is around more and more communities are operationalizing a health equity approach. We see more people focusing on improving community environments as part of their prevention efforts. More and more folks have an emphasis on changing community and organizational norms. And as Ashley mentioned in the beginning, we see more people focused on multiple forms of violence and also aligning with other social justice movements and sectors. And I'm now going to go through each of these and kind of illuminate them a little more so that we can get more in depth in what this all means. So the first theme that I'm going to start with is the one around operationalizing a health equity approach. And this has really been seen by addressing root factors of violence and working together with communities to find solutions. But before we can talk about operationalizing a health equity approach, I wanted to put up a definition of health equity. So what is it? Health equity means that everyone has a fair and just opportunity to be as healthy as possible. And for the purposes of measurement, health equity means reducing and ultimately eliminating disparities in health and its determinants that adversely affect excluded or marginalized groups. So with that definition of health equity, I wanted to pose a text chat question and ask all of you, how do you promote health equity in your work? Maybe you're really focusing on the populations that you find are facing the greatest inequities in sexual and domestic violence and focusing your efforts on them, or maybe in some other ways. So I'd love to hear from you kind of how are you elevating health equity in your work or promoting it. And we'll come back to this text chat question in a few minutes to hear what you're all saying. So at Prevention Institute, we like to use 2 steps to prevention, which is a tool that we use for a range of health outcomes to understand the relationship between a health outcome, exposures and behaviors, and the environment that shapes them. And this also helps identify key opportunities for prevention. So when we start off with sexual and domestic violence and the inequities in them, we often see that women, especially those facing poverty and women of color, as well as young people, transgender, bisexual, gay, and lesbian people face higher rates of domestic violence. We also know that research tends to ignore the sexual and domestic violence that men may have faced. So, you know, there are many inequities presenting themselves across different population groups. So when we take the first step, we move from looking at this health outcome to thinking about associated exposures and behaviors. And so on this slide here, you'll see some individual level factors. This isn't a comprehensive list, but it's just meant to give some examples of exposures and behaviors where there is some research around ties to, I think this is specifically for domestic violence. So things like a history of multi-generational violence, isolation, lack of emotional regulation are all at more at the individual level associated with domestic violence. But this quote here says, it's from the Institute of Medicine, and it says, "It is unreasonable to expect that people will change their behavior easily when so many forces in the social, cultural, and physical environment conspire against such change." So this quote really helps us understand how we need to look broader than just behavior change in our prevention work, and how the environment, you know, plays a large role in shaping behaviors. So let's take a second step to understand the role of the environment or the social determinants of health in shaping these exposures and behaviors. As you can see here, the environment is broken down into structural drivers, which is the outer circle, and community determinants of sexual and domestic violence. The World Health Organization has defined structural drivers as the inequitable distribution of power, money, opportunity, and resources. And that's a key determinant of inequity in health and safety outcomes. At a fundamental level, inequity in health outcomes can be understood as disparity in power. Groups with less power tend to suffer worse health outcomes. And, even right now, we've been seeing how this abuse of power really plays out with people in positions of authority using their power over others, as we've seen as the Me Too movement gains steam. Another way that structural drivers influence health outcomes is by shaping the circumstances that people are born and grow, live, work, and age. And so the World Health Organization also identified community environments as a key contributor to inequities in health outcomes, which includes sexual and domestic violence. Drivers like structural racism and socioeconomic inequality, for example, play out at the community level to deeply impact community conditions. And so this kind of shows how the community environment really can represent an important and actionable place to promote equity in sexual and domestic violence, for sexual and domestic violence prevention. So a quick example that I wanted to share, last year we had a guest presenter from East San Jose, which is in California, and they're an example of a community that has prioritized violence prevention as a community priority. And through its Accountable Communities for Health initiative, they're really focused on changing community environments with engagement of the healthcare sector and also really engaging residents every step of the way. So on their leadership team, they even have made sure that they have resident representation in decision making, and even in places where organizations are being representatives on this leadership team, they prioritize people from the organizations who live within the community, which is really great to see. So Ashley, I'd love to turn it back to you and hear what people have been saying about how they're promoting health equity.
Sure, Alicia. So a lot of folks talked about working specifically with populations who have historically been left out and who have not been brought to the table or included in conversations. So folks are identifying folks in their communities where there are gaps, and folks also mentioned linking other healthcare issues to prevention. So for example, linking women's access to reproductive health. Folks are also partnering with folks in the healthcare field and looking at health from really like a holistic point of view. So looking at physical, mental, spiritual, and financial health is all part of the package. There was an example in Chicago from an organization called Apnagar that are promoting healthcare and healthcare coverage specifically for folks who are uninsured and or undocumented, and they actually have a coalition, so I thought that was really cool. And then I think there was a mention of, Carrie said that we like to focus on the last girl idea when working to end violence. And Carrie, for folks who aren't familiar with what that means, we'd love for you to just share a little bit more in the text chat. That's what I saw, Lisa.
Great. Thanks for sharing. And yeah, all of that really resonates and really matches some of the other themes that are coming up, such as focusing on other issue areas and multiple forms of violence. So great to hear. So our next theme that I'd like to talk about is how practitioners and advocates continue to improve elements of the sociocultural environment, whether it be things like norms or social networks, but practitioners are also expanding their efforts to improve the physical built environment and economic opportunities. And this really works well with our Thrive framework, which is a community resilience framework made up of 3 interrelated clusters: people, place, and opportunity. And this really helps us understand how structural drivers play out at the community level and impact health, safety, and health equity, and how communities can push back against structural drivers. To understand the community determinants of domestic violence and domestic violence inequities specifically, Prevention Institute actually has a report where we looked at the literature base and spoke with key informants to look at the community level factors associated with domestic violence and community level resilience factors associated with safe relationships. And so this slide here kind of shows what we found. So things in the people cluster like healthy norms and culture, or participation and willingness to act for the common good showed up, and then again matching with what the theme is showing with people thinking about the physical built environment and economic opportunities. We're also seeing factors like safe and affordable, stable and affordable housing show up as a resilience factor for safe relationships, and also access to living wages and local wealth. So as you can see, the field is very committed to those changes in the sociocultural environment, and we have seen a lot of movement in communities to counter norms that support gender equity in relationships. The first example I wanted to give that kind of highlights the people cluster is the idea of mobilizing men and boys as allies, and that's something that is gaining a lot of traction right now, whether it's efforts nationally like Coaching Boys into Men, where coaches are working with athletes to really create positive norms in their communities, or A Call to Men, another national effort, or even more local efforts like Rhode Island's 10 Men effort, which we'll link to in the description so you can find out more about that. But we see a lot of work around how can men be part of this movement, and how can they be part of helping change those gender norms. Another example that would also probably go within the people environment is the Idaho Coalition's campaign called We Choose All of Us. This demonstrates the power and unity of all people in communities, and the campaign believes in radical human connection and the power of change that young people hold in schools, neighborhoods, and communities. So this really is exciting work that is youth-led as well. Another example that I wanted to share that's also within the people cluster is Standing Firm, which is another organization that was featured last year in our web conferences, and they're helping businesses see partner violence as an issue that affects workplaces, and really trying to make it an organizational issue and build that organizational capacity to take on the issue. And we can share a link to that in the text chat as well. Now, all those examples were probably more within the people environment or cluster, but as I mentioned, communities are also thinking more about the physical built environment, and one way is trying to decrease alcohol outlet density, which is actually a factor that affects multiple forms of violence. Alcohol outlet density is the number of alcohol outlets in a given area, whether it's bars, liquor stores, etc. And one example that was recently featured in, I think it was the National Sexual Violence Resource Center, their new innovations report, they featured New Mexico and how the state is trying to change policies related to alcohol at both the local and state level, and has a task force for this. So there's some exciting work around alcohol outlet density as part of sexual and domestic violence prevention. And then for around the economic opportunity side of things, I thought I'd share another guest we had last year from Wyoming about addressing the gender wage gap. So Wyoming consistently ranks as a state with one of the worst wage gaps in the country, and so Wyoming is currently trying to figure out what to do with that. So the coalition there and the Health Council and the Wyoming Women's Foundation are working together in a collective impact model to take on this issue and try and decrease the gender wage gap. I see a question here about explaining healthy media a bit more. So one example of that is creating media and marketing. So the negative side would be media and marketing that is harmful in terms of like gender norms. So often we see, oh, Lisa seems to be responding as well. I'll read it out loud for all of you. By healthy media, we mean media and marketing practices that support healthy and equitable relationships, portray healthy and equitable relationships, and limit negative norm enforcing media and advertising. Because of the power of media consumption and marketing and shaping behavior, it is likely that such media and marketing practices would be supportive of safe relationships and reduce sexual and domestic violence. So as I was saying, the negative side of it is when we see media and marketing that objectifies women, for example, and really plays into inequitable gender norms. So healthy media would be ones that really support more of the positive norms. Hopefully that answers. Sorry for being a little wordy there. I'm going to go on to the next slide. So another theme out of the ones that we've been looking at is, again, as we've mentioned, sexual and domestic violence practitioners are looking increasingly at working across multiple forms of violence and trauma and other issues, really finding that a good solution can solve multiple problems. And this follows the Center for Disease Control and Prevention strategic vision to connect the dots across multiple forms of violence. And because I do see some familiar names on our web conference today, I do want to ask the question, because I know some of you are engaged in this work, how are you addressing shared factors to prevent multiple forms of violence and trauma? And again, we'll come back to this. And in the meantime, I'll share an example from another community we featured, actually a state, which is Colorado. Their sexual violence prevention program is focused on addressing priority shared risk and protective factors. So on this slide here, you'll see things like connectedness, positive social norms, economic stability, etc. And so they're really focused on these factors as a way to address suicide, prescription drug overdose, older adult falls, motor vehicle crashes, interpersonal violence, child maltreatment, and traumatic brain injury. And as you'll see here, these really do resonate with some of the factors that I showed earlier that were specific to domestic violence. And this overlap really shows that working in collaborative ways with people focused on other forms of violence and really trying to be more holistic in our efforts, which I think Ashley mentioned as coming up in the text chat before, that people are working in more holistic ways. This really holds true even as we look at this theme. And since I see that we haven't had any text chat responses yet, I'm going to move on to the next theme, but I still invite you to continue sharing here. So the field is another theme that's been coming up. This is the last theme I think I'm going to be going through today, is that the field is recognizing the alignment with social justice movements and other sectors is critical for bringing together diverse perspectives, mobilizing new approaches, and achieving shared goals. So I also wanted to find out from you, just because I'm curious, which social justice movements or sectors have you partnered with? Even if it's not for prevention, maybe you have more experience in the intervention world. Would love to hear what type of partners you've worked with before, and what factors you address together or would you like to address together. And I see a question about the name of the Colorado agency mentioned. I mentioned it was the Colorado Sexual Violence Prevention Program. And I think we can probably find a link to their strategic plan. So we'll try and post that in the text chat. So while you're also responding to the different sectors or movements that you've partnered with, I wanted to share a few more examples with you. The first being the Restaurant Opportunity Centers United. So in 2016, they shared with us how sexual violence prevention advocates are working with economic justice advocates to eliminate the two-tiered wage system by raising the separate lower minimum wage for tip workers to match the regular minimum wage so that no one has to experience financial insecurity, discrimination, and sexual harassment that may come along with being forced to live off tips. And so just to make the connection between this and some of the factors that we showed before, I think that this really fits with the economic opportunity cluster and having access to living wages. And I also wanted to show, that was an example of a social justice movement, and I wanted to also share an example of a sector. So I thought I'd share, since this is something new that's come out recently, Ralliance released its Sport and Prevention Center. It launched showing the role of the sports sector in sexual and domestic violence prevention. And connecting to the factors again, I think this work really connects to really changing gender norms, norms of aggression, and that kind of thing. And other sectors that we've featured before and Prevention Institute is very interested in, we're really interested in focusing on housing, community development, and healthcare, and really seeing what the role of those sectors can be in prevention. With healthcare, already focused on sexual and domestic violence, maybe from an intervention standpoint, what can they really do for community level prevention, as well as housing? There's work being done on housing in the intervention world, but what can be done again for prevention? So one quick example is the Charlotte Housing Authority. They've been doing bystander trainings with the coalition in North Carolina, and really creating policies that require staff trainings and creating a response to violence, which really helps change the norms around non-intervention and make violence, specifically in this case domestic violence, unacceptable within the environment. So Ashley, I'd love to turn it back to you and see what's coming up in the text chat.
Sure. So there have been a lot of really great examples of things that people, I think, are currently doing and kind of like their wish list. So for the first question, how are folks addressing shared factors? In North Carolina, they're using an injury-free academy, which focuses on shared factors across forms of violence. And then there was another example, I believe, from Maryland, where they're using an economic empowerment program. That also I saw come up in the following question, looking at social justice movements or sectors that folks have partnered with or would partner with. So there were quite a few people who are working around economic equity or who are interested in doing that. Folks also were looking at different sectors, so the sex education sector partnering to influence healthy sexuality and promote healthy relationships. Folks were working with or interested in partnering with LGBTQ organizations. There were folks who are working with domestic workers, wanting to partner with immigration advocates. There were quite a few people who said reproductive health advocates. Someone mentioned, I don't know if they want to partner or if they're already doing this, but with the Me Too movement. And I would personally love to hear how folks are thinking about using the Me Too movement to talk about prevention. So those are some of the things I saw, Alicia. There were a lot of great examples. If you scroll through the text chat, you'll see many, many sectors and examples of work folks are doing.
Thanks, Ashley. Yeah, that all sounds really exciting, and I haven't been able to keep up with it all because it's moving so fast, but I look forward to going back and reading all of this, and yeah, I wish I could have like half an hour with each of you and learn about all the great stuff you're doing. So thank you all for sharing. I'm just going to change my slide. So now that we've talked about looking at the community environment and how the community environment can help promote health equity. And we've looked at the types of factors we want to change for sexual and domestic violence prevention. And we've talked about or discussed the types of partners we can do so with. Now we can really focus on comprehensive plans, because once we know what factors we want to change, who we want to do it with, the next thing we need is strategies and what actions can we actually take. And to truly make change so that ideas that support safety in this generation become the instincts of the next. We can't just do one thing, one program. We need to really take a comprehensive approach, and that's the way that we can really get these ideas to truly take form and become the instincts of the next generation. And that's kind of my little intro into the spectrum of prevention, which is a tool that Prevention Institute uses to develop comprehensive prevention plans. This tool was developed by our executive director, Larry Cohen, in collaboration with others when they were working in county government. At the time, they were working on tobacco control and prevention, and they found that people would print brochures about the importance of quitting smoking, and that would kind of be the only prevention strategy. And so the Spectrum tool emerged from the need to differentiate various levels of prevention activities, whether it be influencing policy and legislation or thinking about what organizations can do to change their practices. It also speaks to the importance of forming coalitions and networks so that we can work together for these shared goals, whether it be across different sectors, social justice movements, etc. Also the importance of educating providers, whether it be physicians or whether it be teachers or providers of any sort, as well as these lower levels of the spectrum, promoting community education or strengthening individual knowledge and skills, which are typically the levels people default to thinking to. So the spectrum, again, really helps us think about the different levels. I know the Me Too movement has come up quite a bit today, and we're really trying to be responsive in this moment. So Prevention Institute has created a blog on preventing sexual violence and harassment, and in it we've used strategies across the spectrum. So we invite you to take a look at this blog. We've shared it in the text chat, and also please feel free to send any suggestions or comments, questions to safe@preventioninstitute.org, and you'll see all of that in the text chat right now. So I'd love to move into introducing our guests for today. They are using the spectrum of prevention in their work and are going to share more about it. So we have Amy and Marissa, who are from the Minnesota Department of Health. So Amy is the Department of Health Sexual Violence Prevention Program Director and has been with this program in various positions for 16 years. Marissa is the Health Department Sexual Violence and Prevention Program Evaluator and has been with the program in various positions for over 5 years. As a team, they've refined their program priorities to include a health equity lens in all of their work. The primary focus of their program is relationship coalition building in order to engage individuals and organizations in the power of policy and practice change at the organizational and systems level. So I'd just like to say a quick hi to the two of you, and then I'll introduce Ed. Do you want to say hello?
Hello, can you hear us?
We can.
Great. Hi, this is Marissa and Amy from Minnesota.
Thanks for joining us today. And we also have Ed, who is the co-executive director of Men As Peacemakers, an organization dedicated to the primary prevention of sexual violence, domestic violence, and commercial sexual exploitation. Ed specializes in developing and implementing innovative community-driven strategies to promote equality and prevent gender-based violence. Additionally, he's had 7 years experience as a core trainer for A Call to Men, co-facilitated batterers intervention classes for 10 years, published research on men's involvement in ending violence against women, and is a member of the third cohort of a Move to End Violence. So we're really happy to have you here as well, Ed.
Nice
we can get you to say hello. Thanks.
Can you hear me?
So we can hear you. Great. So starting off with the health department, can you please tell us a little bit about your work and, at a high level, how has the spectrum of prevention been helpful in advancing your prevention work?
Okay, well, hello again, everyone. Marissa and I are excited to be here on this webinar today. And we're with the Department of Health Sexual Violence Prevention Program. And our main objective is to engage partners in making prevention a priority. And so we want to work, we work to encourage folks to focus on broad impact prevention strategies and solutions. And so we do this through formal and informal partnerships with organizations in Minnesota, including coordinating 2 statewide networks, the Minnesota Sexual Violence Prevention Network and also the Minnesota Human Trafficking Task Force. So what we believe is that broad impact policy solutions will help change the social and cultural norms that contribute to sexual violence, and we see this as a particular niche for our work. We work to cultivate prevention partners and encourage policy development and change at the organizational, local, and state levels. And we consider an understanding of causes, conditions, and intersectionality as really being vital to our work.
We use the spectrum of prevention to really help us demonstrate the important synergy at all levels, but also to really highlight those upper levels, again, the policy change and organizational practice change, where we see there is being much broader opportunity for broader impact. So, we really work in these networks to encourage people to focus on the higher levels of the spectrum and also use it for evaluation purposes. We use different strategies to engage stakeholders within these levels, and we really see it as a very important capacity building tool for our prevention work.
Great, thank you both. And I'm very excited to hear more about how you're using it as an evaluation tool as we go. Ed, can you also give us a similar summary of your work?
Sure. So in a lot of ways, we're really a product of the work that the Minnesota Department of Health folks just described. In fact, when I was first starting here on the scene, Amy Kinsey was one of the first people who helped teach me about the spectrum of prevention and the effects of primary prevention. So Men As Peacemakers has really incorporated this perspective that we can create and take innovative opportunities to systematically shape our social environments in our community and in communities around the state to help promote gender equity and prevent sexual violence. And because of the influence of the Prevention Institute and the Minnesota Department of Health, in particular, we have adapted into our very strategic plan a way of looking through the spectrum of prevention for all of our programs. And our programs range from working with young boys in elementary school to high school age girls empowerment groups, to doing work with coaches and athletes, to campus-based sexual violence prevention, and focusing on engaging community men ending commercial sexual exploitation. But regardless of which one of those programs we're talking about, we're constantly going to ask ourselves questions that relate to the spectrum of prevention. If we're putting on an event that's going to build community awareness and community education, we're going to ask how could we leverage that for some of the policy and practice goals that some of our partners and coalitions and networks locally might want to utilize. If we have a program in a school, how might we use what we're learning from the youth and the things that we know from our connection to them to address some of the bigger systematic issues in the upper level of the spectrum of prevention that we might be able to have at least some influence in helping to raise their voices around. And so it's something that we really have an opportunity to build into all of our work across the organization.
Thanks for that overview, Ed. So I invite all of you participating today If you use the spectrum of prevention, please do feel free to share in the text chat how you used it in your work. So I'd like to start off with Amy and Marissa to share how they're using the spectrum at the State Health Department, and then we'll move to Ed, who will share more community-level use of the tool. And instead of going through every level of the spectrum, I'm going to pick out a few for you to illustrate your work. Amy, if we could start off with you sharing a little bit about policy and legislation and how that's fit with your work.
Yeah, sure. So as a government agency, our role in legislative policy is limited, but we can certainly promote the importance of this policy level of the spectrum, and we can also play a role by being at the table and bring our knowledge and expertise to these policy conversations. So we have a couple of examples of our program involvement. First of all, we participate on a policy committee through our Minnesota Human Trafficking Task Force, which is focused primarily on developing and improving human trafficking legislation. And this group meets about every other month and discusses and vets proposed legislation. So in Minnesota, in 2011, we successfully passed a safe harbor law, which includes funding for services and housing, as well as funding for law enforcement training. But now we're beginning to look at possible ways to include prevention policy ideas as well to continue to advance the goals of our task force, which include improving services, response, and prevention.
We also participate on a public policy committee convened by our state sexual assault coalition, which is the Minnesota Coalition Against Sexual Assault. They have 3 to 4 priority areas each year, which include prevention. They have 3 meetings per year, including some subcommittee work, and they set their legislative agenda based on input from their stakeholders and also based on an assessment of the political climate, what is likely to be successful during this political climate. So one example of important prevention-related policy that passed in Minnesota recently, in part through MNCASA's work, is that our Minnesota Higher Education Omnibus Bill, which included $300,000 in our 2018-2017 biennium to support a new position in our Minnesota Office of Higher Education. This position is going to serve as a statewide resource providing professional development and guidance on best practices for post-secondary institutions in Minnesota. And within this, $50,000 each year will be dedicated to training and resource materials. So this was actually effective this past July, and that legislation actually connects with some campus sexual violence legislation that passed in an earlier session in 2015, which really expanded the requirements governing higher education institution policies on sexual harassment and sexual violence, including many components such as amending victim rights provisions and requiring comprehensive training for students and for those charged with investigating and adjudicating complaints of sexual assault. And one important piece is this training is required to include prevention, so we're excited about that. And the position at the Office of Higher Ed was recently filled with someone who formerly worked with our program here at MDH. She has a very strong primary prevention background, so we're really excited about what she's going to be doing there for primary prevention in college campuses in Minnesota.
That's awesome. And yeah, congratulations on this policy success. And I also wanted to apologize to you, Amy, that we're having some technical issues with getting your photo up. So unfortunately, it seems like it's just going to be Marissa's photo. So I'm sorry about that. Another level that I know has been important to your work is fostering coalitions and networks. What networks and coalitions do you convene?
Well, as we mentioned before, we have 2 statewide networks, the Minnesota Human Trafficking Task Force and the Sexual Violence Prevention Network. And both groups meet quarterly, and both groups have supporting listservs where we share information on resources, research, and events. So the Sexual Violence Prevention Network has over 3,000 people on its listserv, and the Minnesota Human Trafficking Task Force has about 1,200 and is rapidly growing. So the Sexual Violence Prevention Network is in its 20th year now, and we host quarterly gatherings of people who are interested in or working in the field of sexual violence prevention. And at each meeting, it includes a presentation on a sexual violence prevention topic and also includes time for networking and resource sharing. And so we have had presentations on a number of topics such as college campus sexual assault, the Prison Rape Elimination Act, sexuality, healthy relationships, exploitation of boys, and on and on. Again, we've been meeting for 20 years. So we always include a primary prevention frame by asking the question, what does prevention look like as we learn about and address these particular topics? And so we use the spectrum of prevention to guide our discussions and engage our participants in prevention activities. And our program also coordinates the Minnesota Human Trafficking Task Force, and the task force was originally coordinated out of the Department of Public Safety, which had more of a public safety lens. And during that time, the task force did really great work around, really great foundational work around improving Minnesota trafficking laws. And then the coordination of the task force moved over to public health in 2012. So our program is now in our 7th year of coordinating these meetings. And we usually have over 100 people attending our quarterly meetings. And it's a very diverse group. We have advocates, survivors, state agencies, healthcare, mental health, criminal justice, and on and on. So this chance to coordinate and host these meetings was really a great opportunity for us to try to infuse the public health prevention lens and help folks to think about the issue of trafficking more broadly and to include sexual violence and interpersonal violence and to understand causes and conditions that contribute to this issue. So the priority for this task force, in addition to improving services and response, is also to build capacity around primary prevention. And our program role and goal with both of these networks is really to try to create a prevention movement across Minnesota.
That's great. Sounds like you have some very strong networks in Minnesota and longevity to them too, which is really great to hear. I just thought I'd share one of the text chat comments, which is about some work in Texas, where they're focusing on multidisciplinary teams across the continuum of prevention, intervention, education, and restoration. And they have a specialized team at the governor's office that is convening and has recently hired a staff member to specifically work on prevention for the whole statewide efforts. So it seems like there's other multidisciplinary teams and coalitions and networks forming across the country. I would love to hear more, Amy and Marissa. You mentioned a little bit about how you've used Spectrum with your networks. Would love if you could expand on that a little bit.
Sure. So we have something we call our prevention networking activity. We use really different versions of that activity at our quarterly meetings of our Sexual Violence Prevention Network and Human Trafficking Task Force meetings. So generally we'll do like a walkthrough of the spectrum of prevention and then have group activities and discussions focused specifically on changing organizational practice and influencing policy and legislation. So we really do like to focus on those levels of the spectrum where people are less familiar and comfortable. And we have found that many people are, because they're not as comfortable working at the legislative policy level, but can be more easily convinced that they have influence at that organizational practice policy level, that's a good place to start to get more traction with folks. And we will often use examples of other public health issues to get folks thinking kind of outside the box, like we talk about tobacco, suicide, obesity, even funnily dog bite prevention, which resonates with a lot of folks in Minnesota. This helps people see and better understand the impact of organizational practice and legislative policy changes that have worked over time with other issues, and then therefore what does that mean for prevention and working at those levels of the spectrum for sexual violence prevention. So we use kind of some variation of this activity at all of our quarterly meetings now, so folks are exposed to these ideas often, and we like to collect their ideas and evaluate their deeper understanding of prevention over time. So by repeatedly facilitating a variety of exercises using the spectrum, participants really continue to learn and practice how to apply these concepts to their own work.
Great. So we have shared the link to the prevention networking activity in case anyone wants to check it out. It's currently in the text chat. Prevention Institute has posted that. And I can really see how you're fostering coalitions through these activities, promoting networking between individuals, and even educating providers on prevention and thinking about it more deeply and comprehensively, including Ed's team at Men As Peacemakers. Marissa, I'd love if you could now expand a little bit about how, as an evaluator, the spectrum of prevention has been helpful for you.
Sure. So we've facilitated versions of this activity where we ask participants to come up with ideas for those top levels of the spectrum, and we ask them to write down their ideas on Post-it notes and then hang them on the wall in the meeting room on large easel pad. We'll have like different sheets of paper for the different levels. And if you look at the spectrum handout in the link, you'll see that's kind of how it's organized. We color-coded levels and ask people to fill out a Post-it note that corresponds to that color. So they'll place their idea on the wall under their respective level of the spectrum that their idea is around. So ideas that they have, which are often based on material that they've just heard presented by guests or by us. And then what we do is we take that and we type it up and we do a qualitative data analysis. And we're actually in the midst of this right now for our past meeting, so that we can kind of see where are they at in terms of coming up with stronger, higher level prevention strategies. It also allows them to read each other's ideas and learn from one another. So it's kind of a multifold strategy. So we liked tying in our evaluation to that activity and do sort of a qualitative analysis comparison over time between meetings. We'll do some more in a year and compare between where folks were at this year compared to next year. So we, again, we use a variation of this activity at all of our meetings now, so folks are exposed to these ideas often, and we feel like this helps us sort of evaluate people's understanding of the spectrum tool over time.
I really like how you're tying something that's an activity along with a way to evaluate it. So it doesn't just feel like a cumbersome evaluation that doesn't feel useful to people, but they're kind of learning through it too. So that's really neat. We're now going to move on to Men As Peacemakers, and then we'll bring Amy and Marissa back at the end. But we'd love to hear from you, Ed, and learn about how you're using Spectrum for your BEST initiatives, which Ed's going to explain a little bit more about what best parties and bars is and how they're changing organizational practices to change party and bar norms. So I'd love to hand it over to you, Ed.
That sounds great. So so the origins of the best party and bar projects that we do are really based in our efforts to actually teach about primary prevention in the first place. They're both efforts, the best party and the best bar, that are focused on shaping environments in order to reduce the likelihood that sexual violence is going to happen in the first place. And what I found some years back when I was giving presentations that explored the problem of sexual violence and then used the spectrum of prevention as a tool to help college students think about what they could do to end the violence, I recognized what a lot of us have experienced, and that is that when I got up to the organizational practice and policy levels in particular, I was losing the audience. Folks weren't resonating with the ideas. I heard a lot about writing letters to the legislature or something like that. And so we started to have specific conversations about what environments, like let's think about environment in a smaller sense, a more micro sense, and what environments really matter to college students. And we landed on the fact that party environments are are one of those things that are almost exclusively controlled by the party students, by the college students themselves. And then we started talking about, well, could we use the spectrum of prevention to think about how to shape these smaller environments and really help them connect with the idea of organizational practice and policy change. And that began a process of working directly with students to sort of explore that question and see if we could do that. But the first problem that we had was that people had a hard time understanding how it is that you actually could shape an environment. Was that something that was actually possible? And so we started talking about organizational policy and the reality of being able to shape environments more through a business lens. So we'd ask people to do something like imagine their favorite coffee shop, and how when you walk in the door, you're hit by that, that roasted coffee smell, and you notice that the lights are dim. It's got a really calming effect. There might be some soft music. What kind of chairs have the owners of that place put in there? Are they putting really uncomfortable chairs that you wouldn't want to sit in very long, or do they put chairs in place that are going to sort of make you sink in and stick around for a while and want to get into a conversation? When you walk towards the front of the shop, and the baristas are trained to know what your name is and what your favorite drink is, and then what they can usually upsell you. Why is that? How come they remember your name? How come they're taught to know how to do those particular things? And we started talking about organizational practice through the way that a coffee shop might be set up. And then we started to compare it, and we'd say, so you've been thinking about this coffee shop and how the owners of a coffee shop who need to make their living by getting you to buy in a ridiculously priced cup of coffee, get you to stick around and spend more money than you originally intended to. Then we said, how does that environment that we talked about compare with a sports bar or maybe with a dance club, something like that? How are those environments shaped using organizational practice? So we'd talk about, the sports bar being set up so that there was a happy hour and specials and things to get people to buy more beer, more drinks during the game, that TVs were positioned throughout, that there were wide open areas for people to stand in and jump around and get excited and that kind of stuff. We talk about the behaviors that would happen as a result. So in a sports bar, you commonly are going to see people, when the Vikings won their playoff game, I'm sure there were people erupting and jumping up and down and beer sloshing everywhere in sports bars across the entire state. And we'd say, what happens if that happens in a coffee shop? And we'd ask the students to start thinking about how it is that those owners had created the physical environment, the actual environment in a coffee shop, to support different behaviors and different expectations than the people who owned a sports bar and in a dance club. And so that was a sort of way of illustrating how environments can actually be tweaked and shaped to have different expectations of behavior. And then we would, and the way that you can use organizational practice in particular to do that. And so that led to the creation of our more formal best party model program. And what we did in that is we asked the students to think about all the organizational practices that exist in shaping a party environment. So from the moment you get an invite or you find out that there's going to be a party, there's a theme, right? The theme is going to be something that shapes how people are dressed, what they look like, what sort of behavior is going to be encouraged at the party. There'd be a really different type of party if it was a Harry Potter themed party versus one that's maybe something like CEOs and sexy secretaries, right? The way people are dressed is going to be different. The way you can kind of expect them to treat one another in relationship to gender equity and sexual violence is probably going to be impacted. That's before you even get to the party. You walk up to the actual party, you might pay $5 to get a red Solo cup. That's an organizational practice that makes sure that there's money for the alcohol at the party. They may want to know they may say that if you want to get in, you have to bring at least 2 women with you in order to get into that party. That's their way of trying to double the number of women that are at the party versus men. Or maybe women get in free. That's an example of another organizational practice. There's a playlist that's going to be chosen. The music sets the sort of tone For the party, there might be traditions that exist, like you have to take a shot in order to get to the front of the line for the keg, or that women need to do a round of drinks every hour or something like that. All of these things are examples of organizational practices that help shape the types of parties that exist. And so we started to really take a close look at how we could be purposeful about our own organizational practices in order to create an environment that expected gender equity and safety. So keep the party, keep the alcohol, all that stuff, but create an environment with different expectations. And that was the goal of the project. We also applied that specifically to bars and to music festivals. And so in that case, we ended up focusing more on the level of how we could work with owners and organizers to do things like mandate training for volunteers, for bar staff, ask venues to put up specific messaging and posters, to give a set of ways, practices that people could put into place that would help promote the messaging that we wanted to see at the music festival or in the bar, and also help shape that environment in a way that made the sexual violence less likely. And so these are a couple of things that have been really fun to work on. They're projects that very much come directly from the community. It's the college students themselves. It's the bar owners. It's the folks who are hosting the music festivals. It's the community of people who care about these things, who are actually generating their own ideas and then using them to shape parties in ways that can help prevent sexual violence.
Thanks, Ed. And this really resonates with the theme that we mentioned earlier on, that more practitioners have an emphasis on changing community and organizational norms. And it sounds like that's really what's happening on these college campuses through the parties and also in bars. So I did want to pose a text chat question to the audience about what other organizational practices could bars and party environments take on to prevent sexual violence. So it might be helpful to think about some of those factors that we talked about earlier on, and we'd love to hear from all of you. While you're text chatting, I wanted to turn it back to Ed and ask what kind of providers you're educating and how you do so. And through that, we had a question come up in the text chat about how to build partnerships with bars, and if you have any advice on that. So I thought that might kind of fit well here with kind of first, how do you get the buy-in from bars and I guess from campuses, and then what kind of providers are you educating through the efforts?
Yeah, so I think that the most success that we've had in educating providers, starting with the question that was asked around bars and music festivals, is actually to actually look a little bit lower in the spectrum of prevention and do some individual knowledge and skill building and community education. And so earlier on, we went through a process of building some champions in the music scene, in the bar community in Duluth, and that's sort of where we started to get connected into folks who were doing the local music festivals here and things like that, through a process very much of sort of raising people's awareness and then, asking them to take a leadership role. And now that we're in the position that we're in with the Homegrown Music Festival, for instance, then it becomes sort of a different way of looking at educating providers, because if you think about any music festival, there are a lot of different entities that are involved in making that happen. There's everything from the bands to the bars themselves who are hosting the music gigs, to the volunteers that help make sure that everything goes smoothly and sell tickets and do things like that. There's training opportunities with each of those communities of folks. There's ways that they can promote messages. There's a lot of opportunity to sort of engage with a broader network of people that are very useful in promoting prevention in that bar or party environment. And we do the same process really when we're talking about college parties. We ask students to think about their parties through the lens of, who all does it take to make these things happen? And one of the first things that we do is sort of map out and identify what the party scene looks like on a particular campus. Are there parties that are particularly run by athletic teams, by the Greeks, by arts scene, international students, there's all these different groups of students who sort of help promote different parts of the party scene, and we work with our Party Revolution groups, the students who are participating in this, to start making connections, inviting those people to come, to throw their own parties and sort of model what a best party can look like. And so it's sort of this way of building a coalition and educating providers, really looking at the providers as the people who are actually throwing the parties. And then on a sort of different level, you can also look at providers on a campus, for instance, through the lens of, who is it that the students themselves are actually interacting with on a daily basis. So in our case, we oftentimes work a lot with residential life. We'll ask first year experience to partner with us. We will work with athletic departments, and the goal there is to not only have like one program that the students can interact with, but also to educate the providers that the students are interacting with on a daily basis, so that they're getting a consistent message from those folks, along with the way that they're learning to shape their party environments.
Thanks, Ed.
The only other.
Yeah, go ahead.
I was going to the question too. The only other thing that I would say about educating providers and making connections to bars and parties on college campuses is that it's great to never underestimate the power of mandating things either. So when it is appropriate, we've used that as a way to get connected with the entities that we need to, whether that be like athletic programs or a certain set of students, or in our dreams, we'd like to see actual liquor licensing and things like that change, so that the bars themselves actually were compelled to be involved in the prevention strategy.
Right. It's very important. We had a quick question in the text chat. If Best Parties in Bars is copyrighted, are you aware of any copyright on that?
Yeah, it's something that we've been developing over a period of time as a project, and we actually are researching it as we speak now to have a curriculum and a train the trainer process that we're hoping to release in the relatively near future. But I mean, the ideas that create the idea of utilizing the spectrum of prevention to shape environments is something that I think anybody can do in their own way that fits. And we love to partner with people, so if folks have ideas, they should certainly let us know.
Great. So looking at those lower levels of the spectrum, how do you promote community education and strengthen individual knowledge and skills? I know you've already hinted at it a little bit, but thought you could kind of round off your response.
Yeah, I think, and it's interesting to talk about it separately because they do really run together so much. But the community education level certainly fits into the way that we utilize our curriculum now and do work with students in order to build their understanding and awareness around the issue of sexual violence and practice how they can use the spectrum to shape party environments. So the curriculum itself is certainly a community education strategy. Whether we're talking about parties or whether we're talking about bars and music clubs and things like that, we will come up with themes for messaging, for prevention messaging, and utilize those themes. I think I've got a slide of that here. Like 1 year for the Homegrown Music Festival, it was #NoCreep, and we came up with a whole set of posters and themes around that showed up all over town. And when we did media and when we did training, we tied into that specific message and sort of have a meeting that meant prevention and gender equity to folks, and helps amplify the process of that community education. So that's the most direct example. Another thing that we really encourage folks to do in bars, at music festivals, and on college parties too, is think about how it is that they're going to actually articulate what they expect from other people. So the posters and messages like this can be really useful in doing that. But we also ask students, for instance, to come up with creative ways to express, we call them sort of with a little bit of sarcasm, party rules. But we get them to think about the values that they have together and what they want to see happen at the parties. And so you get things like they really don't want to see fights happening at the parties. They don't want their stuff broken. They don't want people to be not using the bathrooms properly, things like that. And so they find creative ways to communicate that, and then we ask them to insert within that things around respecting women, having respect for people of all gender identities. You commonly see them put stuff up that says things like no racism, sexism, homophobia, transphobia, or other general ways of being a jerk. Sometimes the language is a little bit more crass than that in the way that they'll communicate these things. But as they come up with their stuff, like a consent-related one that's really popular right now is ask the cutie before you touch the booty. They think of that in a way that applies to people of all gender identities. And so when they come up with those things, then we start to ask them to find ways to display them, post them, and practice talking to their housemates, their friends about them, so that it's a process really of educating their broader community about the expectations that they have for their parties and their living spaces.
Thanks, Ed. So Ashley, we don't have too much time, but anything high level to share out from the text chat?
Sure, yeah, there were some good examples, Alicia, of ideas that bars could take, and so providing bystander training to staff, setting up some kind of like a text line that folks could send a text message to if they needed assistance. And then there was an example from Stephanie in Kansas where there is a program called Safe Ride that provides free rides from bars back to, I believe, a campus. And as Stephanie pointed out, that gets to multiple issues around driving under the influence. And then someone also had the idea of promoting consent and hotline services using a hand stamp. So a lot of times bars, when you go in, you get a hand stamp. So doing some messaging that way.
Oh, that's neat. Yeah. Cool. Sorry, next slide. So the last thing that I wanted to share before we bring all of our guests back to share some tips was, we talked about each of these levels through all three of our guests today, whether it's changing organizational practices or influencing policy and legislation. But, it's not about doing one thing and not the other. It really is about that synergy. And as Ed mentioned, often there is overlap between the different levels. And again, it's just important to be thinking about these different levels to really come up with comprehensive efforts that can prevent sexual and domestic violence. So I'd now like to move into some tips from our guests. Ed, I thought we could start off with you sharing, I think it's your first two, and then we'll move to Amy and Marissa for the last two tips on the slide.
That sounds great. Yeah, I think my first tip is in using the spectrum of prevention and the public health approach to primary prevention. We've sort of learned that it's just critical to center the community and those most affected in those processes, and also to communicate those intentions. And of course, that's best done if the leadership and the modeling and the projects are actually shaped by those folks. Part of the reason that we talk about that is that public health tools, sometimes to those most affected and marginalized, have been experienced in ways where it was put down upon them and sometimes did not have the best positive effect on their communities. And so this, to us, is an opportunity to use the spectrum of prevention in sort of an inverted way, where the community itself is the one that is thinking through these structured levels of strategy in order to shape their environments. So that would be the first suggestion, and then the second is just to really consider the synergy of the spectrum of prevention. We just started practicing, it became an organizational practice of Men As Peacemakers, that when we were doing debriefs on our programming, check-ins with one another, planning for the year, things like that, we practiced having a spectrum of prevention on our wall and talking about, okay, so let's think about how we could use organizational practice and policy with this, with everything that you're learning from this program. How could you do that? So any way that you can practice the synergy of the spectrum really increases the power of the prevention strategy.
Great. And Amy and Marissa, if we could get you to share the last two tips.
Yeah, I would say that sometimes when we're thinking about sexual violence prevention, sometimes we just kind of overthink it because of the complexity of the issue. So I would say a tip might be to really try to think outside of the box and think about prevention examples from our everyday lives rather than at that time thinking about sexual violence. I think thinking about everyday prevention can make the prevention concepts easier.
And then lastly, just the importance of practicing, getting in touch with the practice of prevention, which is why we do our prevention networking activity at all of our network quarterly meetings, so that folks can really get familiar with thinking about prevention at multiple levels and practice. Thank you.
Thank you. Thank you to all three of you for joining us today. It was very valuable to learn from folks working at the state level and local level and see kind of even the synergy between the work you're doing and how it really works together. So thank you, all three of you, for being here for our kickoff web conference foundations session today. Before we end off, we want to share some tools and resources. So first, we have both sets of guests' websites for you to check out if you want more information on their work. We also have our, as Ashley shared earlier on in the web conference, we have our 2017 PreventConnect report that just came out last week. So we invite you to check that out. Please feel free to share it with your colleagues and your networks. And then the content that I shared today around Thrive, the people, place, and opportunity, and the factors, a lot of that comes out of this report here, a health equity and multi-sector approach to preventing domestic violence. Prevention Institute is still working on this project called Sectors Acting for Equity, and really looking at implementing the approach. So hopefully we'll be able to share more about that in future web conferences. And then NSDRC's Innovations in Community Level Prevention is another exciting report to check out. The example of New Mexico that I shared and their alcohol density work is something that I read about in this PDF, so I recommend taking a look at that. And that's all I have for today. Anything else from any of our guests or Ashley?
I don't think so, Alicia. I just want to thank you all so much for joining us today. Thank you, Alicia, Morgan, and the entire Prevention Institute team. And of course, Amy, Marissa, and Ed, thank you so much. I will be sending out a link to a evaluation survey, and there is a certificate of attendance that is available after you complete that. We really love to hear from you and certainly take time to discuss what you all are saying about our web conferences. So we really appreciate if you complete that. We also did record this session and hope to have that recording available to view within the week. You will receive an email when that is available, as well as a transcript of the text chat. But you can find the PowerPoint slides and the prevention, the activity that Minnesota mentioned on the PreventConnect website now. So thank you all so much. We look forward to our next web conference next month, and you will be receiving, if you're on our mailing list, which I hope you are, you'll be receiving information about that, how to register in the next couple of weeks. So we look forward to seeing you on a future PreventConnect web conference. I hope you all have a wonderful rest of your Wednesday. Take care. This concludes our session for today.
Thank you for listening to this PreventConnect podcast. PreventConnect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on PreventConnect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about PreventConnect, visit www.preventkonnect.org. For more information about CalCASA's mission, or to show your support, visit calcasa.org. That's CalCasa.org.